of EMSP Virtual 2020. Yesterday was an amazing day filled with great presentations that ranged from cutting-edge research in progressive MS to the inspirational remarks from someone who's lived with progressive MS for 30 years. Today, we're going to hear presentations about navigating some of the real-world challenges of living with progressive MS, from accessing healthcare to managing the emotions of living with progressive multiple sclerosis and navigating employment with progressive MS. And before we get started, I have two reminders to share with you. First, please remember that you can make a donation to EMSP directly from the conference platform. And most importantly, please remember that this is an interactive conference, and we've made it super easy for you to respond to the quizzes that you see by using the chat box on the right side of your screen. In fact, to get us started, we're going to do a one-question quiz right now. And the question for today's quiz is, why are you joining EMSP 2020 today? To connect with the MS community and see my friends, to learn about the ways to adjust to life with progressive MS, to learn about the latest scientific developments for progressive MS, and I need one more event to reach a 1,000th virtual event attendance achievement for 2020. Finally, I'm just passing by. Well, I think we're all here for the right reason, it would appear. Perhaps the single most important aspect of living with progressive MS is having access to healthcare. Joining us for a deep dive on the subject is the head of health professionals programs at the MS Trust, Meghan Roberts. Meghan has been an MS nurse for almost 25 years and was one of the first MS nurses in the UK. She's widely published, and Meghan has even written a textbook for MS nurses. Meghan has worked for the MS Trust for 5 years and has played a key role in developing the role of the Advanced MS Champion in the UK. She's also the lead on implementing the MS Trust Specialist Nurse Program, which funds additional MS nurse posts in areas of greatest need. And Meghan also runs the MS Trust training module for new MS nurses and therapists. Please join me in welcoming Meghan Roberts to the stage.
Thank you, John, and thank you so much for inviting me to speak here to you all today. I'm delighted to be able to present this session. I think access to healthcare is something that's very close to my heart and something that I've worked with throughout my career and really try to be a great advocate for. So our objectives during this session are to try and identify some of the main challenges people with progressive MS experience when trying to access services. And I'm delighted to have such a fantastic panel of people here to help us explore this further. I'm going to start with just a few slides that will set the context, give us a bit of an overview of the situation across Europe. And then I'm going to get the panel to introduce themselves to you, and we'll start to broaden out the discussion. As John said, the session is going to be as interactive as we can make it. If you have any questions as we go along through the session or during the questions and the discussion with the panel afterwards, if you put them into the text box, the chat box, we'll do our very best to get through as many as we can before the end of the session. Okay, see if we can make this work. I have a next slide, please. Thank you. Next one. Thank you. So a lot of this data I've taken from the EMSP MS Barometer, which is a collection of MS data that's gathered by the national MS societies across all the countries in Europe. I think 32 member societies were involved in the most recent collation of data, which is fantastic. This is all available on the EMSP website, the MS Barometer website, and I would urge you to have a look. There is a huge amount of data on there, and I've just picked out a few of the most relevant bits to share with you this morning. Some of you may already be very familiar with it. The ethos of the MS Barometer is based on the World Health Organization vision that everyone in the world should be able to access high quality healthcare when and where they need it. So the right care at the right place and at the right time. So the data I'm going to share with you this morning is from the 2017 version of the MS Barometer. There is due to be an update published later this year, but I haven't been able to just share that data with you just yet. So there are 4 sections to the MS Barometer, and I'm just going to focus on this one about access to healthcare, which is obviously most relevant to us for this session. So this chart might look a little bit complicated, but you can see that all of the countries are labelled down the bottom and then each has a score. And what this summarises is a whole range of different indicators, all related to access to healthcare, that give us a score, an overall score for each country. So the indicators that the EMSP have looked at are things like how easy it is to access DMDs, how easy it is to get symptomatic treatments for MS, the costs of healthcare, the availability of rehabilitation services, etc. in each country. And then it comes up with a score, and that allows us to compare overall access to healthcare for people with MS between all the different countries across Europe. As you can see in the chart, a lot of the Western countries do better than the Eastern countries in terms of access, and that's a theme throughout this, unfortunately. However, you can see there is a great variation between all the countries, and no country has perfect access to healthcare for people with MS. I've got a couple more slides now, which I'll share with you. If I could have the next slide, please. Thank you. So this slide shows you the availability of healthcare professionals across Europe and how that varies. And I think this is fundamental to being able to access healthcare. If we haven't got the right numbers of professionals and the right type of health professionals available for people with MS, then we're not going to be able to get the right care when we need it. So as you can see, the numbers vary across the different professions. And this is overall across all the countries. If you have a look on the website, you'll be able to see the breakdown across the different countries. Every discipline is under-resourced. Psychologists particularly are in short supply, and that's something that's come out in the most recent data as well. Neurologists, the people vary. So we have, for example, in Moldova, there are no practicing neurologists, whereas in Russia, there are about 27,000. As I say, there is much more detail available. This is a chart from some work that was done in the UK in 2016, just to show you how services, a bit more of the detail that will be evident within each country and the variation. So as you can have a look at this chart, as you go down the list of services on the left, you can see psychology and counselling at the bottom. They have the poorest provision in the UK, but none of the services have more than 65% availability within the UK. And these are all services that people with progressive MS will need to be able to access. A recent survey of neurologists in the UK also found that there are only 1.1 per 100,000 people in the UK, which is about a quarter of the number found in France and Germany. So you can see there's a great deal of variation around between different countries. So this slide focuses on rehabilitation, and I think neurorehabilitation is again one of those areas that is so important to people with progressive MS and is so often under-resourced, and certainly in the UK is an area that we really don't. As this chart shows, only 9 countries across Europe are able to provide access to rehabilitation for everyone in their country, and you can see that in the table to the left. And in the UK, say we can only manage access for around half of people with MS. So this is another area that is a big challenge. As well as access to neurorehabilitation and to the right MS health professionals, it's really important that people with MS and their carers and their families are able to access the information and support they need when they need it. Formalised support for carers, again, varies hugely, with less than 2/3 of countries being able to offer any specific forum that carers can access for support. And information for carers comes almost entirely from MS charities in each country, so that their role is a really, really important one. Now, although the focus of this session is on access to healthcare services for people with MS in the ongoing sense, I don't think we can ignore the fact that COVID-19 has had a huge impact on health services over the last 9 months or so. This slide just gives us a flavour of the impact we've seen in the UK on MS services, but I'm sure that this type of pattern will be replicated across the whole of Europe, indeed the world. In the UK, many MS specialists were redeployed during the first wave, so moved out of MS services and sent to work in ITU or in different areas of the hospital. There's been less of that this time around, but many MS services are still facing huge disruptions and have long waiting lists. Most face-to-face appointments have been stopped, and MS specialists are delivering their care by phone. That works well for some people, but it doesn't work for everybody. And certainly people with the most progressive MS, more advanced MS, will have more difficulty using the phone and getting the most from their consultation via the phone. Most telling, rehabilitation services have been most badly affected, and almost 3/4, 75%, of health professionals report that their rehabilitation services have been impacted worst of all, and many of these are still trying to get back to offer any type of usual service. So at the end of each section within the MS Barometer, there are recommendations, and I've just picked out 3 here from this section about accessing to healthcare, which I think are particularly relevant for us to think about here. And I think the recommendations are that every country must work to improve the delivery and availability of MS specialist care and rehabilitation. I think that's fundamental. Every country needs to increase the number of MS and also to look at getting training and standards for them that are uniform in Europe. And I know that the EMSP is doing a lot of work to try and support that and facilitate that. And also to continue to develop information resources and tools to help people with MS, their carers, friends, families, and MS health professionals access the information they need to help people with MS live the life they choose. So whilst the data from the 2020 update to the report is yet to be published, we do know that the latest data continues to identify major gaps and differences in terms of access across Europe, particularly between Western countries and Eastern countries. Another major concern that's come to light is that in terms of mental health support, and I think right now that's more important than it's ever been. Mental health is always a huge issue for people with MS and people with progressive MS particularly, but I think with the pandemic at the moment, it really is a major concern. And we know that a stronger response on mental health support, particularly around cognitive behavioural therapy, is vital right across Europe. It's also become clear that in many countries across Europe, we can no longer afford to have exclusive MS centres, and therefore we need to aim for MS specialised rehabilitation healthcare professionals to be spread throughout each country to ensure that specialised care can be provided for everybody with MS closer to home, coming back to that right care in the right place at the right time for everyone. So it now gives me great pleasure to be able to open up the discussion to our fantastic panel of speakers who should be joining us any moment. So we have Chrysa from Greece, Piet from Belgium, Daphne, who is the president of RIMS from the Netherlands, and Donna, who is part of the EMSP Young People's Network. Hello. So I'm going to ask each of you to introduce yourselves in turn, and then I have a couple of questions, but please, for all of you who are out there listening to us, if you have any questions, please do put them in the chat box. That would be fantastic, and then we can ask the panel. So Donna, let's start with you. Would you like to introduce yourself?
Hello, good morning everyone. My name is Donna Nahal. I'm from the UK. I'm part of EMSP's Young People's Network. I'm a patient leader, advocate, and I volunteer for MS Society UK and Shift.ms. I'm a speaker, blogger, and vlogger. I share my 18 years experience of living with MS.
Well, thank you, Donna. That's fantastic. Really amazing experience that you're able to bring to us today. So thank you really for joining us. Chrysa, could you tell us about yourself?
Good morning. I'm so happy to be here with you. I'm Chrysovitsanou from Athens, Greece. I have been working the last 30 years in MS field. I'm a MS nurse specialist, and I'm the supervisor of MS center of EGINITIO hospital. It's a hospital that belongs to University of Athens. In our center, we have almost 2,500 patients who help and follow. And my interest is a center of multiple sclerosis all these years. And thank you for your invitation.
Thank you for joining us. That, again, fantastic experience. And that's a huge caseload. How many of you are in your team to look after all those people with MS?
How many members of the team?
Uh-huh.
Okay. We have many neurologists. We have 2 social workers, one MS nurse, that is me, and we have other nurses, 5 nurses, but they don't have the certification of the specializations in MS. And we have the other members of the team. They are not regular members. They are only cooperation with us when they need. We call them when they need.
Thank you. Yeah,
We're
I
trying
think
to do our best, but it's difficult
yeah, I think
sometimes.
yeah, like everywhere, I think that we're all thin on the
Yeah,
ground. There's never enough
yeah,
people to do what we
yeah.
really want to be able to do. But thank you.
But in Greece, we have many neurologists. That's the good part of the.
Well, that's
But
good.
not nurses and all the other members of the team.
Yeah, sounds like you need some more nurses. I have to work on that
Yeah,
one.
yeah,
Yeah,
that's true.
yeah. Piet, good morning. Do you introduce yourself?
Hello, my name is Piet, Eelen. I'm working as a clinical nurse specialist in the National MS Center of Melsbroek in Belgium for nearly 40 years. I'm working there as in the clinical follow-up of the persons with MS on DMTs and also in supporting research projects. And I'm also responsible in our Multiple Sclerosis Center for the education of the MS nurse. In our center, we are really lucky and we're working with lots of MS nurses. And beside this, I'm the chair of the Belgian MS Nurse Association, organizing also and focusing especially on organizing conferences and academies for training and support and teaching of the Belgian MS nurses.
Thank you. I think, it's really interesting to hear the contrast between where you work and where Chrysa works. But I think it's fantastic that you're so involved in education as well of MS specialists. I think that's a really important thing. We need to be able to train MS specialists to be able to make a difference to people with MS. So Daphne, to you, last but certainly not least, please tell us a little about yourself.
Yes, hello. My name is Daphne Kos and I am current president of RIMS, Rehabilitation in MS Society. And I have been involved in RIMS for about 20 years now. and I'm also a board member of the Belgian Society for Neuro Rehabilitation. And RIMS is a network of MS centers and MS rehab specialists across Europe and also beyond Europe. And we organize several educational events, and we bring the community together to learn from each other. So I'm looking forward to this panel discussion, and thank you for inviting me.
No, thank you so much for joining us. I think your experience is fantastic, and certainly to have that focus on rehabilitation, which we've just heard is so important, is really great to have you here this morning. So thank you to all of you for joining us. So as I say, if people want to ask questions of any of the people here this morning, then please do put them in the chat box. But I'm going to start. So Donna, I can come to you first. What have you found as somebody living with MS to be some of the main issues and challenges that you faced when accessing MS services?
I would have to say my experience echoes the statistics you've shared for the UK. When I was diagnosed in a small town, my hometown, with a small hospital, and I was under the care of a neurologist. It wasn't someone who specialised in MS care, and I feel that had a real impact on my treatment, disease path, and my progression. I had to deal with the psychological effects of that, and of the diagnosis, which again I didn't receive any support for. And I was dealing with, these emotions, a lack of self-esteem, and it was having an effect on my relationships, my education, and work. I feel like it's only when my care was moved to a city close by, where there was a bigger hospital, I was offered things like a cognitive assessment and a neuropsychology test, and that for me just made me just helped me to deal with what I was going through. It it validated my experiences, really, because for so long I was going on with these symptoms, questioning my own experience, and that was difficult for me. I feel like, again, now I am getting the care that I need. I've been referred to a rehabilitation centre which has a specialist MS department, and there I've received neurophysiotherapy as opposed to just physiotherapy, and they've been able to offer me things like an electrical device that helps me to walk, whereas I found accessing a wheelchair was not difficult, but I want to hold on to my mobility for as long as I can. When you have progressive MS, it can seem quite dark and bleak, but it really isn't. If we're able to hold on to what we've got, and make the best of our lives, we can live with MS well for longer. Um, I also felt that there wasn't much support for my family. They really struggled with that. Because I was young when I was diagnosed, I was 17. They felt that they really had an onus to ensure I was getting the care and the treatment that I needed. And there was an element of guilt for them and of pressure, but they weren't offered any support. And I feel like the language and the cultural barriers for me were difficult too, because as you mentioned before, the onus was on me to communicate my MS to them in order for them to support me.
No, thank you. That's a really sort of honest sharing of your journey. What do you think would have really made a difference for you and your family? What else could have been done that wasn't?
Personally, for me, I really feel like the psychological support at diagnosis and throughout the different stages of MS, because it's an ongoing thing. Once you're diagnosed with MS, you don't suddenly, have the thought that, oh, okay, yeah, I understand that now and that's it. It's always evolving, always changing. And for my family, just some support maybe in the way that they could access, because it was very difficult for me being told about this condition that I knew nothing about in English, and then having to communicate that to my mom, for example, whose first language is Punjabi. I think we need to make sure that we are providing this support for everyone, regardless of their background.
Yeah, I think that's a key point, and certainly it's something that we try and address as just speaking for us as a charity, but it's sadly it comes down to resources, and I think that's in terms of the language sort of thing, and having information available in different languages, and I think that's the problem with resources is often at the bottom of this, isn't it? Thank you, Donna. We'll come back to you. Chrysa, just I'm interested in your experience as sort of we've highlighted the fact that you're on your own as an MS nurse with a huge caseload of people, so the best will in the world can't possibly provide the sort of support one-to-one with all those people. What's been your experience of trying to provide services for people with MS? How does your role work, and how are you able to provide support to the people that you do see?
First of all, we have a program for new diagnosed patients, where the patient has the opportunity after they have met the doctor and they took the diagnosis for multiple sclerosis, and then there is an appointment with the MS nurse to discuss everything, every issues, information about the new medicine that the patient is going to have, and solve all this problem that a new diagnosed patient has to face. After that, we have a support teams. We call them a support team for new diagnosed multiple sclerosis patients, and we have a different support team for the relatives. Nowadays, we're trying to have support groups for progressive MS patients, where the things are, I think, are more difficult and they need more support and help. Also, we are trying to give them directions about their rights. I know very well that MS patients in all over the world, sometimes they don't know what are their rights, what they deserve to have as medical care or general help. I think that people with MS, they have the progressive MS, have more difficulties because in some countries, as it is in Greece, they have a problem to have a rehabilitation help, because they don't have many rehabilitation centers, or maybe they have to pay some an amount of the rehabilitation program. We are trying to give all the information to the patient, but as Donna said before, all the information we have as health professionals, we should to give to our patients in a simple way. We have to speak in their language and make them understand what happens when they have multiple sclerosis. And I think another problem is nowadays we have some new medicine for progressive MS. We have to clarify in a patient's language, in simple words, and give them evidence-based information about all this new information they have to face, and help them to use the internet or other where they search for help with caution, and to know how to look and find the evidence-based, the right information.
Yeah, thank you. I think that's absolutely spot on. I think the importance of sort of signposting people with MS to the different services and resources that are available to them is a really important thing. There's so much out there, and you know, I'm sure, Donna, you know that people need different things at different times in their lives with MS.
Yeah.
And I think often as MS specialists, it's down to us to point them in the right direction and let people know what's available in that area. And I think, Donna, as you highlighted, often it's, you know, depends where you live as to what's available and what services you can access. Pete, what's your experience in Belgium of you know, working in a specialist MS centre? It sounds like you're probably much better resourced. Is that the case, or?
Well, I think first of all, Belgium is a small country and a well-established national health security system that's quite accessible for nearly everybody. And also reimbursement is good organized for MS rehabilitation. And besides that, we see that several rehabilitation centers work with special conventions to reduce even more the personal part that the patient has to pay. But I think being a small country, we have a lot of general hospitals, university hospitals, rehabilitation centers that offers a neurological follow-up, especially for persons with MS. And so the access for a patient is quite good organized. And you can say that even in your neighborhood, there is a good organized general or university hospital where you can go to for your special support. But I think most all, most important development, I think, is the multidisciplinary consultation, which is organized sometimes together and sometimes without the support of the Flemish MS Society. So in our center in Melsbroek, we have developed the transmural multiple sclerosis support, we call it like that, because we're not doing only consultations, multidisciplinary consultations in our center, but we really go abroad, because as I've said, and as you have said also, Megan, probably in the future there will be no more the possibility for 100% specialized MS centers. And we feel that even the access in the neighborhood of the patient to general and university hospital is easy. Sometimes we see that your neurologist, sometimes with or without an MS nurse, that the support they give is not quite comprehensive. And that's why we from Melsbroek, we deliver our multidisciplinary team throughout Belgium, and we are going to do the multidisciplinary consultation together with the local neurologist and the local MS nurse. And we go to, well, 10, 15 hospitals in Belgium. And I think this multidisciplinary consultation is quite important to give a perfect support for the patient.
Yeah, no, thank you. I think it absolutely vital, that multidisciplinary approach. I don't think, you know, the needs of people with MS are so complex, and so, you know, covers such a number of different areas that no one health professional can give people the support that they need on their own. Are you able to take your team out and into people's homes? Is that something you're able to offer if they need them?
The home visits can be organized, but we see the last years that we do it a lot lesser. But there where there is complex situation, and we really need to put the finger on the pulse, like we say, to see what is the big problem. Then we can go to the patient's home also. Yeah.
I think that,
Also, sorry. No, I want to say also with the multidisciplinary team, especially mostly it's an occupational therapist and a social worker, sometimes with the MS nurse or the rehabilitation doctor.
That's really interesting that you've got the social worker involved. Certainly in the UK, that's something that we really struggle with. Social care, I'm sure Donna, you'll be well aware of this, is very separate from health, and yet it's one of the biggest blocks often to people receiving the care that they need and to keeping people well and safe at home, and so that's really good to hear that you're able to offer that. Yeah. Daphne, if I could come to you, I mean, as president of RIMS and the huge amount of experience that you've got, what are some of the main challenges that you've come aware of over all that time that health providers face when trying to deliver rehab services, and how do you think we can start to address these? Just an easy question.
The golden question, right? Yes. Well, I think some of the things have already been raised by other panelists today, and one of the major initiation, of course, of rehabilitation services is the referral to rehab, and Donna already raised that as well. Like you have several questions at several times in your disease, and you would like to have them discussed throughout your journey. And this early referral is something that is already increased in acknowledgement during the latest years. But it still remains very important that people will be referred to rehab throughout their disease. And the rehab services should be multidisciplinary, multi-professional, as already raised as well. And I think that's also one of the issues in many countries. We see in several countries like Belgium and Italy, it's very quite well organized actually, with this interdisciplinary collaboration and communication. But I think there is a gap in a lot of countries there. People with MS will be seen by neurologists, by MS nurses, in the best cases, and by physiotherapists most frequently. But all the other disciplines are so important as well, as Donna already said. This psychological support, the support in managing your daily life by several other therapists, the possibilities you have for reimbursement, the financial support you can have, which is discussed by social workers. It's so important to have them all on board. And of course, it's not easy to, not always possible to have them always on board, but you should be in some way be connected with all these professionals when you can reach out to them if it is needed. And one of the strategies already used to improve that is the creation or the proposal of an MS care unit. I presented this yesterday in my presentation, where some minimal requirements are published. And I think that's a start for a lot of countries especially where rehab services are not so well organized yet. And I think that is the start of a rehab service. And along the journey and along the development, you can you can increase services, you can increase the number of professionals involved, maybe also the how do you say that, the systematic organization of all these professionals in one team. And of course, one of the challenges is resource. I think that's always a challenge everywhere. We need resources to do so, and we have a lot of countries where there is no reimbursement or a very limited reimbursement for such services, and that's actually the start. I mean, that's something we should really fight for to gain for all people, to have at least a partially reimbursement for these services, because otherwise not all people will be accessing this. And then another challenge I would like to raise is the person-centered care. During the last 10 years, I must say, we strive for a personalized program, really tailor-made for that person, in this case with MS. But it's of course a challenge, because we need time. We need time to have a personalized care. We need resources, and we really want to make this concrete. But we see that a lot of services are really organized in a manner of, this is the service, this is what you get, and you can take it or leave it. But we really need to make that personalized and to make that tailor-made for each person. And well, how can we deal with that? Piet already mentioned several ideas from Belgium, how that is organized with this transmural support teams. I think that's one of the ways to go. The specialized MS centers, it's very difficult to have them in all countries and at several locations within a country. But of course, if you have some kind of core team that you can reach out to community, that you can be in contact with community services, with MS organizations, with funding bodies, I think that's the way to go. And of course, in countries where these services really need to be elaborated from a kind of bottom perspective, it takes some time and takes some efforts, but I think that's the way to go. And maybe just one last bit, sorry. I think healthcare professionals individually and teams of healthcare professionals should be collaborating with each other as well, and communicate with each other and reach out to each other and learn from each other. And that's actually the role that RIMS will take up and already takes up here. So I think that's already a strength we can have. But of course, if you want to use that community, you have to enter the community as well. So a warm welcome for everyone who is involved in rehab.
Thank you, Daphne. Gosh, lots of points there, but I think so many good suggestions and really helpful ideas. I think the bottom line is that there aren't enough health professionals, but that's not easy to fix. And I think we have to start by working with what we've got. And I think your points about each country having a minimum set of standards at least to work to is a really good start. And then it comes back to education about not just of MS health professionals, but of every health professional and social care professionals about that early referral. I think that's certainly something that I see time and time again, that health professionals are telling me that they're just not getting to people with MS early enough to be able to make a big enough difference that they might have been able to if people have been referred earlier. And I think that comes down to education really of other health professionals wider, and that's something I think that we all need to play a part in, and certainly RIMS will be part of that. And the networking of health professionals is also key, as you say. That is something that's so important, that we all learn from each other, and help each other to make a bigger difference and provide better services and resources to people living with MS. So thank you. I mean, Daphne, before we sort of move on, there's a question come in from somebody who's listening to us, asking about mobile apps, if they're useful for people with MS, and whether there's any examples that you're aware of particularly good practice around using apps, etc., across Europe.
Mm-hmm. Yes, well, there is, of course, that was actually another point I wanted to raise. There is, of course, a lot of a window of opportunities with apps, with remote monitoring, self-monitoring of symptoms of daily living, and I think that's also some way of some strategy to reach out to more people with MS, and to increase the access of care. And of course there are some examples, but the examples are quite, how can I say that? I don't know the English word for that, sorry. But there are examples of applications, but the problem, the main issue with most of these things is that they are not really developed in a way that it is that it can be used in healthcare. And of course, self-management is important, and people are free to use whatever application. There are applications to stimulate physical activity. There are applications to increase your mental health, to look for or to train, for example, cognitive performances or cognitive capabilities. But yeah, it's such a large area and such a broad range of possibilities there that just in order to be very helpful also for rehab specialists, it is important to discuss this with the healthcare professionals, and how can it help you? How can you be supported in doing so? I think, of course, that's a strategy a lot of people with MS will use, and especially when we look at the period now in this corona pandemic, it's of course a strategy that can be used, and that has been used quite a lot nowadays. I have heard from a lot of people with MS that they have been using some training and things like that. But and of course it can be supportive, and it can help people in maintaining their capabilities. So it's very welcome. But we have to be careful to use either or any application. We really have to be careful in what we are using in general, but also for people with MS.
Mm.
Not all applications are that well developed and that well researched to be able to have a proper effect.
Yeah, no, I think that's really important. I think that goes back to what Chrysa, what you were saying earlier, about the importance of guiding people in terms of what's credible information, what's useful. There's a lot of information out there on the internet, isn't there, that's not always as helpful as it might be, and guiding people towards the
never forget. I just wanted to add, most of those apps we are using now are quite pharma biased. Yesterday there was a presentation of the iCompanion. That's maybe a good suggestion. But the most important thing for me is that you only see what you're looking for. So if you don't guide, if you don't train, if you don't support the person with MS, then he will not find everything that's important for him on the app, even on an app.
Yeah, no, thank you. I think there is a real role for health professionals there in just signposting again and guiding people living with MS. Donna, have you had any experience of using apps as somebody living with MS?
I haven't myself, if I'm honest. I haven't used apps, but I do ensure that I'm monitoring my own MS. As I have gone through my MS journey, I've come to realise that this relationship with my healthcare team is a partnership, really, and I need to do my bit in order for them to do their bit to the best of their ability. So I do think being able to monitor your own MS is important, and if there are apps out there that will make it easier for people with MS to do that, then yeah, it's a really good way of doing it.
Thank you. We've had another question in from the people listening, but just before we do that, Donna, I just wanted to come to you and ask you whether you feel access to services has improved since your diagnosis, and what your hopes are for the future for people living with MS.
For me, I'd say yes, personally, but I still feel like there's a lot of work to do, in order to get the right care at the right time, as you were speaking about. I feel like the disparity in the UK should be addressed, and that across Europe as well. We need to make sure that no one's left behind, and that's irrespective of where they live or their background. That I would like to really see some, a minimum standard or even a gold standard, a universal one, and we learn from the countries that are really, doing well in these areas, and we can develop things in our own countries, to enable people with MS to live better.
Yeah, thank you. I think that's, yeah, I mean, we were talking about minimum standards before, and I think you need those, but absolutely it should be a gold standard really that we're working to. And I think one of the themes that's come through loud and clear while we've all been talking this morning is about learning from each other, and sort of networking and then sharing that information between ourselves and best practice, and whether that's through organisations like the EMSP or RIMS, or within each country the different organisations that exist. But I think ultimately it's all about coming together and working with people living with MS, your people like you, Donna, who are out there telling us how it should work. You are the experts ultimately. You know what you need, and how it should be working, and it's really important that you're able to hold us to account and tell us what it is that's working and what's not working, so that we can try and do something about it. I think that kind of brings us to the end of this session, and I'm sorry we weren't able to get to all the questions. But I would just like to thank all of you so much. That's been a really interesting, a really helpful discussion, and it's been great to see you. I'm sure we'll go on to have a fantastic second day at the conference. But yeah, so thank you, each of you, and well done.
Thank you. Bye-bye.
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 Thank you.